Good morning and welcome to Frisbee Hospital. I get the pleasure this morning of introducing everybody, turning it over to Kathleen Lewis. But I want to make a couple of simple comments. I want to welcome everybody on behalf of the Greater Chambers from Dover, Rochester, and Somersworth to this Tri-Chambers Commerce State of the State Breakfast Forum with our Governor, Governor Hassan. We have tried and have increased our presence in the community this year from the hospital standpoint. We've tried to interact with more groups, more services, focused on more health concerns in our community. But in addition to that, we've tried to strengthen our relationship with the school systems and with individuals that are less fortunate that seem to disappear into the background. If you have the chance before you leave today to get out into the main lobby of the hospital, this morning's, the month of March is Spalding High School. Every month we rotate senior artwork in our main lobby. And we do this through the course of the year. At the end of the session, we're going to take there's a winner every month that the employees vote on. We're going to take the 9 winners, put them on the wall, and have the community come in and vote for the winner. The winner will be given a $1,000 scholarship from Frisbee. Greg Hopkins, my partner in this from HBL Financial, we're going to give a $500 scholarship to each of the 2 winners from the other 2 high schools. The quality of the art will blow you away. It is absolutely stunning. So I strongly encourage you to, if you have the chance, take a walk through. It's a way for us to better connect with our senior students at the high schools. In addition to that, this month we reached out to School Street School, and we have the 1st, 2nd, 3rd, 4th graders artwork down there. It's adorable. It is one of the most fun things. Employees flood the lobbies every month as we rotate these, so it's kind of fun to do. The other special announcement I want to make before I turn this over is that when we were having one of our Rotary meetings, it was brought to light that in our community, there are dinners for the homeless, less fortunate, on every day of the week except for Saturday. So we have people in our community going from Friday, many of them high school students that are homeless, going from a Friday out of school till a Sunday before they get another meal. Effective April 9th, 4 o'clock to 5 o'clock at the Grace Church next to Profile Bank, Frisbee is adopting Saturday nights, and we will be providing a meal to anybody in need, free of charge of course, at the Grace Church. So we're going to start with the program. We want to make sure that it's done respectfully, that it's, again, as all food is from Frisbee, it's 100% made from scratch. No boxes, no frozen, no canned goods. It is an amazing food program we have here that we're bringing back into the community. Every meal will have fresh fruit, something to challenge people. Thank you, but that's what community is all about. That's where our focus is. So I welcome you here this morning, and I thank you for all your support for the events and the programs we try to bring out into the community. It's my pleasure to welcome and recognize this morning from the chairman of the boards from Rochester. We have T.J. Jean from the Gaffney Home. Dover, we have Sean O'Connell, Shaheen Gordon. Somersworth, we have Lara Willard, now from Goodwin Community Health. The chamber executives, we have from Dover, we have Molly Hodgson, executive director. Laura Ring, president of the Rochester Chamber. Somersworth executive director is Sarah Potter. The next Tri-Chamber of Commerce event is going to be a business after hours. It'll be held on Thursday, May 24th at the Holy Rosary Credit Union here in Rochester. So with that, again, thank you for coming this morning. I'd especially like to thank Eversource, our partner, underwriting today's forum. I'd like to thank my staff from Frisbee Hospital for the excellent meal that they put on and the fun little flowers they create from fruit. This this is what Frisbee is about. It's about making sure that fun is part of our life. And it's with great pleasure I'd like to introduce Ms. Kathleen Lewis, the Community Relations Manager for Eversource. Thank you.
Thank you, John. Thank you for hosting. Welcome, everyone. What an incredible opportunity to be here this morning with our governmental officials here in the greater Rochester, Dover, Somersworth area, and to be with our business leaders of this region. As New Hampshire's largest energy provider, Eversource, and our over 1,500 employees are proud to serve over 211 communities in our state. But there's no region in the state that is growing as significantly as the greater Dover, Rochester, Somersworth area and the greater Portsmouth area. We call it the greater Seacoast, and it's growing at twice the rate of the rest of the state, and we expect that in the year 2020, over 25% of the state's electric load will be here in this region. And that's why we're committed to our customers to provide reliable electric service and to face one of the issues of our state, energy supply. We're investing over $300 million in our infrastructure, and specifically here in the greater Seacoast region, to directly benefit the Dover, Rochester, Somersworth area. We're proposing the Seacoast Reliability Project, a new transmission line that will serve our businesses and serve our customers in this area with reliable electric service. In our view, energy and energy supply is one of the critical issues of the state, and our employees are proud to work here, to live here and raise families here. We have many families and employees in the greater Rochester area. We have an office here in the city. So on behalf of everyone at Eversource, I want to welcome all the business leaders and the governmental officials here. And before I introduce the governor, may I simply take a moment to recognize some of our government officials here. In uniform, we have our Stratford County Sheriff, David Dubois. I know I saw him earlier. Thank you. We work so closely with our public safety officials, and we appreciate everything you do. We have from the New Hampshire State Senate, Senator David Waters is here this morning. Thank you. Our Stratford County Commissioners, Leo Lassard, George McGlaris, and Robert Watson. Thank you. Our elected officials from the City of Rochester, City Councilor Elaine Lauderborn, our school board member TJ Jean, and from our Rochester School Board, Robert Watson. Thank you. From the City of Dover and the Dover School Board, Betsy Andrews Parker. Thank you. And our elected officials from the City of Somersworth, Mayor Dana Hilliard. Thank you. And our city councilors, Nancy Cameron, Jessica Paradis, and Jennifer Soldati. And I don't want to miss any of our elected officials that serve our residents in the state. Did I miss anyone? Raise your hand. We appreciate you being here. This is an important opportunity to network. Clearly, there's teamwork between governmental officials and our business leaders, and we're very pleased to welcome this morning the governor of New Hampshire, Maggie Hassan. She's here to provide us with her insight on state issues. She's also here to answer your questions on the important issues that impact businesses in the state. So it's my privilege and honor on behalf of the chamber members and behalf of our Eversource employees to recognize and welcome the Honorable Governor of New Hampshire, Maggie Hassan.
Thank you very much. Thank you all. Please have a seat. I really appreciate it. Thank you. Kathleen, thank you so much for the introduction and for everything you and the team at Eversource does for our state and our communities. John, thank you as well for hosting us all. To Molly and Laura and Jennifer, thank you all for the work you do on behalf of your business members each and every day. Mayor Hilliard, it is great to be here with you. I know we went through the list of elected leaders. I do want to give a special shout out to Senator Waters for being here today, not only because he's got a big district and a lot to do, but today is crossover in the New Hampshire Senate. So that means that he is going to leave here, drive over to Concord, and then have one heck of a long day in the New Hampshire Senate. You know, this is where the Senate has to get all its bills out to go over to the House. The House yesterday had to get all of its bills to get over to the Senate. So it's all of the, at the end of the session is always when all the difficult things that nobody could agree on earlier have to get dealt with. So David, thank you for being here this morning, and thank you for your service. And to the entire Tri-Chambers of Commerce, it was really great to hear Kathleen describe, you know, everything that's happening in this part of the state. And I am just very, very grateful for everything you all do to foster a truly vibrant business community in Dover, Rochester, and Somersworth, and to help maintain the region's high quality of life. It is critical to our state's economic future, and it's really just a great honor to be with all of you today. I did want to take a minute this morning to reflect on what's happened this week internationally. We do continue to join the people of Belgium in grief and in mourning following this week's horrific acts of terror. And we remain united in our collective resolve to rid the world of violent extremism perpetrated by threats like ISIS. The cowardly and twisted ideology that drives such heinous terrorist attacks will never match our strength, and it will never slow the steady march of freedom and progress across the globe. There are no immediate or credible threats to the Granite State, but we are going to continue to work with federal and local public safety officials to remain vigilant and to monitor the situation closely. As always, our citizens should be vigilant too. And that means if you see something, say something. And that means not just in your physical environment, but on social media too, right? And I know that we'll all continue to work together to make sure that we continue having a safe state where everybody belongs and is included. Here in New Hampshire, the businesses represented by the Tri-Chambers are working to make smart strategic investments in building a stronger economic future and a better community, which helps drive our whole state's economy. And that's what I'm working to do throughout the state. With the business community in the Tri-Cities helping to lead the way, we've come a long way since the depths of the recession. And the state of our state is strong, and it is getting stronger. Our unemployment rate continues to fall and is now 2.7%, which is among the lowest in the country and the lowest level here in New Hampshire in nearly 15 years. And for the third year in a row, New Hampshire was ranked the strongest state in the union based on more than a dozen measures of economic strength, community safety, and quality of life. Every single day, Granite Staters roll up their sleeves and they work together to solve problems and improve our communities. They really set a very strong example for their elected officials. Following that lead, we continue to prove that in New Hampshire, we can bridge the political divide and accomplish great things together. That started with enacting 2 fiscally responsible bipartisan budgets while holding the line against a sales or an income tax. We came together and lowered taxes for small businesses while protecting our ability to invest in critical economic priorities now and into the future. Priorities like encouraging innovation, making college more affordable for all of our people, ensuring that hard-working Granite Staters have access to quality, affordable health care, combating the heroin and opioid crisis, and fixing our roads and bridges. We put our state's financial house in order, working across party lines to end expensive lawsuits that threatened our long-term financial outlook as well as our bond rating. Thanks to a strong economy and careful management of our state budget, we finished fiscal year 2015 with a $62 million surplus, doubling our rainy day fund to its highest level since 2009. We have made real bipartisan progress to set the foundation for a new generation of innovative economic growth. But our work to keep New Hampshire moving forward must never cease. While our state's economy certainly remains ahead of the curve, the American economy has fundamentally changed. It's critical that we equip our people to adapt to this changing economy so that we can build a future where everyone has the opportunity to get ahead and then stay ahead. We know that our people, our families, and our businesses cannot grow and thrive, first and foremost, without safe communities. And that's why our first responsibility of government is keeping our citizens safe. Thanks to our remarkable public safety officials, we are one of the safest states in the nation. But we all know that the heroin and opioid crisis remains the most pressing public health and public safety issue facing our state. Last year alone, more than 400 Granite Staters died from a drug overdose, with the majority of those deaths being from fentanyl, heroin, or another opioid. And thousands more overdosed, their lives saved only by the quick action of first responders, by medical providers, or their family and friends. We all recognize the serious threat that substance abuse poses to our people and to our high quality of life, to our businesses, and to our economy. And we've been working together to strengthen our efforts to combat this crisis. Last fall, I called for a special session of the legislature and proposed comprehensive legislation to stem and reverse the tide of this horrible epidemic and to help save lives. And in January, I signed 2 bipartisan expedited bills. Thanks to that swift action, we are cracking down on fentanyl, streamlining access to treatment, and strengthening our prescription drug monitoring program. But we know that this fight is far from over. We must be constant and focused in our work to strengthen these efforts and to give patients, providers, families, educators, and law enforcement better tools to combat this horrible epidemic. Combating the scourge of addiction requires us at times to change the way we've always done things. And we have to do it at a quicker pace than sometimes is comfortable for folks. And it also requires additional resources and dollars. While some may say that we can't afford to take steps that require additional funding, I believe we can't afford not to. We've allocated funding for the state police to assist the Manchester Police Department's Operation Granite Hammer in seizing illicit drugs and arresting street-level dealers. And Manchester has seen significant success with this initiative. But as you all know, Manchester is not alone in facing these challenges. We need to expand this effort to support local law enforcement across the entire state to communities like Dover, Rochester, and Somersworth. And while we know we have to continue supporting law enforcement on the front lines, every single police chief who I have spoken with makes it clear that we can't arrest our way out of this problem. Strengthening our prevention, treatment, and recovery efforts, and removing the stigma of addiction remain critical parts of a truly comprehensive approach. To help prevent addiction in the first place, we're working with local school districts to help our young people understand the dangers of substance abuse. Both chambers have passed legislation to build on those efforts, and will continue working to strengthen youth prevention programs. We also know that this epidemic stems in part from the overuse, misuse, and abuse of addictive prescription opioids. So we're working to improve provider training to prevent the overprescribing of opioids. We've started a series of nationally recognized provider trainings, and in the last several months, the boards of medicine, nursing, and dental examiners have set a strong example by adopting emergency rules on the prescribing of opioids. Now we have to build on that example by requiring the boards governing all prescribers to adopt updated permanent rules this year. We must also ensure that providers have the tools that they need to turn these trainings and rules into action. That includes upgrading technology to strengthen our prescription drug monitoring program and to ensure that more prescribers can use it in a timely fashion. We have some outdated software that we have to upgrade to really make this more user-friendly. And while our work to increase the safe and effective use of Narcan has saved lives, Narcan is not a cure. Addiction is a disease, and we have to ensure that those afflicted with addiction can access services to treat this illness just as we would for any other chronic condition. That means we must also strengthen support for the Governor's Commission on Alcohol and Drug Abuse Prevention, Treatment, and Recovery. Across the state, those in recovery and families who have lost loved ones have shared their stories. They've inspired us with their bravery, and they're making a profound difference in the lives of countless others who are battling addiction. To support them, we must ensure that New Hampshire citizens have access to immediate treatment and then a robust, long-term recovery system. I've proposed legislation that provides an additional $5 million for prevention, treatment, and recovery programs, and there is widespread recognition that we need to provide additional resources for these critical services. The Senate is voting today on this proposal, and I have to report that unfortunately, some folks in the Senate are pushing to reduce the funding and to create new bureaucratic hurdles that slow the process of getting these important resources to our communities. With a strengthening economy and strong state revenues that are currently outpacing projections by approximately $60 million this fiscal year, it's clear that we have the resources to take additional steps to combat this crisis and help save lives now. We're talking about bills in the Senate that might cost about $5 million. We've got $60 million above projections coming in revenues. So we can afford to do this, we need to afford to do this, and I hope you will all join me encouraging the legislature to act with a sense of urgency and provide their full support for these important prevention, treatment, and recovery programs. There's also broad consensus that we should expand existing drug courts and establish new drug courts across the state to help prevent people from slipping back into addiction and crime. Locally, Stratford County has long been at the forefront of drug courts, but drug courts can only work if they are backed up by increased treatment capacity. If the courts have no place to send people who are now ready for treatment, the drug courts themselves aren't going to do their jobs. We have revised licensing requirements to make it easier for providers to open new treatment facilities. New Hampshire, though, has long lagged behind other states for treatment capacity. And that's one of the reasons that we really have to reauthorize our bipartisan New Hampshire Health Protection Program without delay. As I think everybody in the room probably knows, already thousands of Granite Staters have accessed substance abuse and behavioral health services through our bipartisan expansion plan. And experts have said that reauthorizing expansion is essential to increasing treatment capacity into New Hampshire. That's primarily because as we have treatment providers, they need to know that the coverage that Medicaid expansion provides will be there in the next couple of years before they invest the capital they need to expand capacity, right? So that's one of the reasons it's such an important step for us all to take. And more than 48,000 hardworking Granite Staters now have the health and financial security that comes with quality, affordable health care coverage, thanks to the New Hampshire Health Protection Plan. Since expansion began, hospitals have seen a significant decline in inpatient, outpatient, and emergency room visits by uninsured Granite Staters. So another benefit of the expansion program is that our hospitals now provide less uncompensated care, and that reduces the shifting of healthcare costs that we have seen onto people and businesses. The state has also seen an increase in revenues from the insurance premium tax as a result of expansion, and we are beginning to see cost savings elsewhere, thanks to preventive and primary care and other benefits that the program covers. Combined, these measures are expected to save taxpayers a total of $29 million in avoided costs over the next biennium. With the expansion population now on private insurance through our premium assistance program, we're helping retain competition in our insurance marketplace, competition that will strengthen options and affordability for all Granite Staters. So the program has helped us make great progress, and I just want to take a minute not only to recognize that, but to thank the business community for your support for expansion. It's been critical to the progress we've been able to make, and your continued advocacy for it has really made a difference, so thank you. It's also clear that the New Hampshire Health Protection Program is making a real difference for our people and boosting our economy at the same time. So I just also want to let you know that the full House voted in favor of reauthorization, and I'm hopeful that the Senate will vote to reauthorize this critical program next week, but your phone calls certainly wouldn't hurt. As we continue our work to keep our communities healthy and to combat the heroin and opioid crisis facing our state, we also have to confront other threats to the safety and well-being of our people. From the evolving and unique threats posed by the like of ISIS and other terrorist organizations, to the increasing acts of gun violence and mass shootings across the country, we must continue to be vigilant in our efforts to keep our communities safe and secure. This includes our ongoing work to expand our Information and Analysis Center, enhance safety plans at our public schools, institute active shooter trainings for police departments across the state, and strengthen cybersecurity. And it has never been more important than it is now for New Hampshire to continue our strong practice of unified training and community policing. The Police Standards and Training Council helps prepare our dedicated officers for the challenges and dangers that they face every day. And right now, the council is facing a funding crisis. So I want to take a moment to thank Dover Chief Colarusso and Stratford Chief Du Bois for their leadership on this issue and on the council. We cannot let down our dedicated and brave law enforcement officers or the people that they protect. We must maintain our commitment to public safety and pass legislation that adequately funds police training. Our safe and healthy communities are the foundation of our state. And one of the reasons that New Hampshire is indeed such a great place to live and to raise a family. So I'll take a minute to thank all of you for everything you do to support law enforcement, but just also to thank law enforcement for everything they do. We have several members of law enforcement in the area. And to maintain the high quality of life that our men and women in law enforcement work so hard to provide the foundation for, we also have to continue working to advance other critical priorities priorities that support economic growth and help innovative businesses like yours create jobs, the kind of jobs that will strengthen and grow our middle class. When I visit businesses across the state, you continue to tell me that a strong, highly educated workforce remains your number one need. A strong workforce, of course, begins with a strong education at all levels, from early childhood to our K-12 system to higher education. A high school degree is rarely enough for jobs in the changing economy, and our people need access to affordable higher education in order to climb the ladder of opportunity. We've made important progress to hold down the cost of higher education in New Hampshire. We froze in-state tuition at our university system for the first time in 25 years, and we actually lowered tuition at our community college system. A new partnership is bringing state and local government together with the education community and other stakeholders to work towards a new 65 by 25 goal, ensuring that 65% of New Hampshire's population holds a post-secondary credential or degree by the year 2025. We must also continue working to prepare our students at the K-12 level for higher education and for the challenges of a changing economy. That's why, together, we increased math requirements for our students, and building on the efforts of our STEM task force, we're developing stronger science standards for our K-12 public schools. We're developing new options for math classes, and we're working to integrate coding into our curriculum for a 21st century education. Across the country, New Hampshire is recognized too as a leader in competency-based education. Through our PACE pilot program, 7 school districts, including Rochester, and 1 charter school are now reducing the level of standardized testing in favor of more locally managed assessments that are integrated into a student's day-to-day work, a model that is expanding nationally based on New Hampshire's success. But in order to ensure that our schools can continue to be innovators in public education, we have to meet our financial commitment to all of our students. Dover is helping lead this effort, and I've been clear that the legislature should fund our full commitment to adequacy and do it this year. As we educate our young people and build the highly skilled workforce of the future, innovative businesses looking to grow here in New Hampshire need more workers right now. We have an opportunity to better use the talent of our own people right here in New Hampshire, helping our businesses thrive while closing the opportunity gap for New Hampshire's children and families. We're proud that New Hampshire's child poverty rate is among the lowest in the nation, but no child should live in poverty. And the best indicator of the long-term success of a child is the success of his or her parents. Children whose parents are able to work their way into the middle class are themselves more likely to stay in the middle class. That's why I've announced a new plan. It's called Gateway to Work, aimed at developing and expanding our workforce as our economy continues to strengthen, while at the same time closing the opportunity gap for our families. Gateway to Work repurposes existing federal funds to help Granite Staters succeed in the workforce. With this new initiative, we have the opportunity to help those who are on the New Hampshire Health Protection Program or on other state programs move into jobs that pay sustainable wages, lessening their need for public assistance. Through Gateway to Work, we will strengthen job training, create new apprenticeship opportunities, help remove the barriers that cause too many of our citizens to fail in the workplace, and help our young people get a leg up on their futures. So first, we know that many good-paying jobs at innovative employers require more than a high school education. We've seen success with partnerships between our community colleges and innovative businesses, such as the partnership between Great Bay Community College and Albany Safran. So we will establish more partnerships between the community college system and the business community to create apprenticeship programs in high-need areas such as advanced manufacturing, information technology networking, and healthcare. These are solid, good-paying career pathways that will help expand our middle class. Second, while businesses need workers, they are often reluctant to risk the investment of time and money that comes from hiring someone who may require additional training or who lacks reliable access to childcare and transportation. We'll help overcome such obstacles for workers and businesses by providing employers with job training grants and salary support for eligible workers for 6 weeks. This will help ensure that workers can get a fair shot at a new career while providing businesses with the workforce that they need to grow and to thrive. Third, we also know that there are individuals who just face significant barriers to joining the workforce. Goodwill of Northern New England and Families in Transition in Manchester have begun a pilot project in Manchester to help individuals served by the Temporary Assistance to Needy Families program overcome barriers and enter the workforce. We'll partner with these nonprofits and other organizations willing to address this challenge through efforts such as increasing case management, eliminating child care copays for those TANF clients, and expanding in-home visitations to work with more at-risk parents. Each of these steps will help these individuals enter and then stay in the workforce. Finally, because work experience as a young person can help ensure success in school and in the workforce later in life, we'll strengthen our efforts to prepare at-risk youth for the workplace. We'll expand after-school and summer youth employment programs for young people, including apprenticeships and on-the-job training. And we'll create a pilot program that will allow school counselors to work with at-risk middle schoolers to develop education and career plans. Through Gateway to Work, we can provide more of the workers our businesses need to thrive, and we can give more of our families the opportunity to work their way to self-sufficiency and into the middle class. As we invest in giving families the opportunity to work their way to a better future, we know that the success of both our established businesses and new startups also depend on our efforts to continue strengthening our transportation infrastructure. The 10-year transportation plan is the next step in our work to strengthen our infrastructure, and I've put forward a 10-year plan that advances critical transportation goals while maintaining fiscal responsibility and living within our projected revenues. It's a plan to preserve and fix our bridges, a plan to preserve good roads now in order to avoid more expensive projects later, a plan that completes the expansion of Interstate 93, and a plan that advances several key improvement projects for the Spalding Turnpike. And as we work to strengthen our transportation infrastructure, we also recognize that the high energy costs we have remain a burden on people and businesses across our region. We must strengthen our energy infrastructure and diversify our energy resources to reduce costs for our families and businesses, to create jobs, and to reach a more reliable, clean energy future. As large-scale energy projects are considered, we must work to ensure that any proposed project will deliver real benefits to our ratepayers while incorporating local viewpoints and protecting our communities and our natural resources. And we must continue to be a leader in promoting clean air and combating climate change, which threatens our economic future and the health of our citizens. Thanks to initiatives like RGGI, like our Renewable Portfolio Standard and our long-term energy strategy, our growing clean energy sector has resulted in New Hampshire being ranked as one of the top 5 states for renewable energy. In recent years, New Hampshire's families and businesses have invested millions of dollars in our local economy by installing solar arrays and other renewable generation facilities, decreasing the need for new transmission projects in the future. Because of our clean energy sector's success, we're now at the statutory limit on net metering, which is a critical tool for individuals and businesses to be compensated for the energy that they provide to the electric grid and to other customers. Both legislative chambers have passed legislation lifting the cap on net metering, and I urge the Senate to agree with the House proposal and send me final legislation so that we can continue our clean energy progress. Supporting our emerging clean energy sector is critical to protecting the natural beauty that makes New Hampshire a special place to live and to work, to visit and raise a family. But we also know that there is more we have to do to support our job-creating businesses. New Hampshire's been ranked as the 5th best state for entrepreneurship, but we're focused on becoming #1. Through Live Free and Start, we're bringing together business leaders and entrepreneurs to make it easier for innovative companies to start up and grow. We've worked to modernize our securities regulations, ease the process for registering a business, and connect our startup community with angel investors in order to increase access to capital. And Live Free and Start will continue working to help innovation-based businesses start, connect, and succeed in New Hampshire. Each of these individual efforts, from combating the heroin and opioid crisis and reauthorizing the New Hampshire Health Protection Program, to workforce development and supporting innovative businesses, to reducing energy costs and protecting our environment, are fundamental to our shared economic success. We've come a long way from the depths of the recession, working together to address the priorities that are critical to supporting our vibrant communities, encouraging a thriving economy with a strong middle class, and maintaining the high quality of life that we're known for in New Hampshire. But our work to advance these priorities must continue if we are to help our citizens adapt to the changing economy and to build a stronger, more innovative New Hampshire. These are the priorities that I have fought for since becoming governor, and they are the priorities I'll continue working on with Republicans, Democrats, and Independents now and in the future. Time and again, we continue to prove that New Hampshire is a place where we make government work for our people and our businesses. A place where we embrace individualism and community like nowhere else. A place where we overcome our political differences, we move past the inevitable arguments, and come together to make progress for our people, our communities, and our economy. A place where we are facing the challenges of a changing economy head-on, keeping our communities safe and secure, and working together to help our families and our businesses adapt and thrive. That important progress is not possible without you, our job-creating businesses. And I want to continue to hear from you about how our small and nimble state government can support your hard work and remain responsive to the needs of this business community. And I also want to continue to thank all of you for demonstrating what it is not only to be strong businesses, strong leaders, but also to be so engaged in your community, whether it's through your business or through your volunteer activities. In New Hampshire, nobody waits for other people to get things done. We just roll up our sleeves and we do them together. And that's also one of the great secrets of our success. So I thank you because I know I'm looking at some of the region's busiest people on all sorts of levels. You make a real difference. I really look forward to continue to working with all of you, and I look forward to your questions. Thank you.
And I don't know if we have time for questions. What was the plan? John, you think? Okay. Yep.
We do have time for questions, so if anybody has one. A quiet group of New Hampshire business leaders. Yes, ma'am.
They almost always ask the same question, I'm very sorry. I run the local homeless shelter
Yeah.
in Western, and it seems to take forever to get someone on the phone at DHHS. They're just overworked and
Yeah.
underpaid, and clients aren't getting the services that they really need.
So thank you for the feedback, and I want to connect you with my policy person in that area. We also, our new commissioner, Jeff Myers, is trying to address some organization issues that I think may impact that, and I'd like him to connect, him and his staff to connect with you too. So make sure that William Hinkle, who's standing right back there, has your contact information, and I appreciate the feedback and thank you for your work. We'll have, oh, whoops, there.
If the state has $65 million left in the budget, a surplus this year, why can't that be used for the underfunding of the DOT that has happened in the past and go to the bridge funds and get more bridges, for example, or more roads fixed and off the red list, rather than going into rainy?
So the law delivers that money into the rainy day fund, so it is not discretionary money unless the legislature were to decide to remove some of it and put it into our highway fund. And I think there's a general feeling that the rainy day fund, it's also something I believe, our rainy day fund was down to $9 million. As you know, as wise business people, when you try to close your books on a budget that in total is $10.5 to $11 billion, right, our biennial budget, with a $9 million rainy day fund, our bonding agencies, our rating agencies, nobody thinks that that's a healthy amount of reserves. So it is really important that we take that surplus and a portion of that surplus went to the rainy day fund, a portion of that surplus was already dedicated to some other things that we needed to shore up. But we do need to continue to work as effectively as possible on our transportation infrastructure for sure. And it's one of the things that our DOT has done is we're working on some qualifying federal money to help with some of our more rural projects. But thank you for, it's always important for all of us to hear about how important transportation infrastructure is to our community because it helps keep people focused on it. So thank you. Yeah, Warren, how are you?
Thank you for the discussion on the state of the state. With all the due respect to this room, I'm seeing not a lot of youth or younger business leaders here. And you know, you've articulated that with Live Free at the Start, which is a great program. One of my associates, Hollis McGuire, is part of that. Yeah. And as far as as well as the partnerships with the community colleges. But you know, as baby boomers retire, there's potentially a gap there with business leadership. Are there any other programs that you're supporting around filling that gap?
Thank you. We certainly need to retain and attract more young people here in New Hampshire. One of the reasons that I focused on the cost of higher education as much as I have, besides the fact that, you know, working families need to be able to afford higher education and the burden of student debt is outrageous. The other reason I focus on it is to keep young people in New Hampshire who can right now travel across the border and go to a community college or a public university system in one of our neighboring states, often for less than we pay here, and then we charge here. So then once they've left, it gets harder to get them back. So that's one of the reasons. It's, you know, I had this wonderful woman tell me, it was a year ago, she was one of our award-winning statewide students in a number of areas, and she was going off to Montana State to study engineering, you know, and I'm thinking, you know, an 18-year-old woman who's interested in engineering, she had made half the things in the room, you know, she's clearly going to start her own business, do all sorts of wonderful things, and she said, look, I could go to Montana State, and even with the travel back and forth, I do much better financially than if I stay in New Hampshire. And so we really, really have to focus on that. We also have to recognize that young people have different priorities about kind of the way they want to live and work. One of the reasons I've been such a promoter of bringing commuter rail in Nashua and into Manchester, you know, that on the seacoast, the Downeaster is doing really well. But we need to be able to attract young people to come work here, even if they want to live for a while in Boston. Then once they decide they're gonna settle down a little bit, maybe have a family, they really like New Hampshire. So, I want them to be coming up here to work. The other thing we know is that young people more and more don't necessarily want to drive and own cars, which I find amazing when I think about how hard I fought to get my driver's license at 16 years and exactly like 4 months or something. But they really, with the onset of Uber and with their use of public transportation, that has become kind of a threshold thing for them. They're just not interested in coming to a place where you have to have a car, and they really want to be able to live and work in kind of about the same neighborhood. And having rail into Nashua and Manchester would be good for that, as well as obviously, lowering air pollution and traffic and the commuter headaches that everybody who travels across the border has. So it's one of the things that I've really focused on. And then Live Free and Start continues to work on incubator programs and singling out especially young entrepreneurs. But we would love, the director of Live Free and Start, who is the state's director of entrepreneurship, which I think is a great title, is a woman who works with my office and with the Business Finance Authority named Liz Gray. And one of the things she does, by the way, is profile a kind of business of the week on our Live Free and Start website. So I would invite all of you to check out the website and to contact Liz if you have ideas, one, about businesses that she could profile, but two, if you have ideas about how we can work to attract more young people and young entrepreneurs to the state. I think that will also come as we attract more angel investors. And we had our first angel investor conference in New Hampshire that Live Free and Start put on. I think it was November. And we're beginning to remind the investing world that New Hampshire is a great place to invest for innovation-based companies too. Yeah.
As a hobby, I'm the second vice president of the New Hampshire School Board Association. It's not why I'm here today, but we had our board meeting last week, and we met with all the delegates from our congressmen and senators in D.C.
Yeah.
And the overriding concern was definitely about opiates.
Yeah.
As a school district issue, really. It wasn't that the students were having drug problems, it's that the students need support because the parents
Right,
are addicted.
Yeah.
And we're finding it's an overriding theme in the room that they are fighting for funding for grants for mental health and drug and alcohol counseling within the school districts. What is the state looking to do as a statewide initiative to make sure that there are resources available to local school districts for students who live in basically a drug impacted household?
Yeah. So we have a multifaceted response to the epidemic, which includes working to make sure we have more behavioral health and substance abuse treatment for families at a community-based level. That's one of the reasons I've asked for more funding for the Governor's Commission. The Governor's Commission on Alcohol and Drug Prevention, Treatment, and Recovery is really the table where stakeholders from all of the different impacted groups, so we have law enforcement, we have substance abuse treatment providers, we have full range of stakeholders. They are the people who come together and use the funding they are provided to be strategic around the issues that they see, whether it's expanding capacity or a particular issue coming up for young people like the one you have described. And it's one of the reasons we need more funding. We need everything from more treatment to supported housing to more prevention. So one thing we need to do is really get those dollars back out to the communities, to programs like the one you would describe. Our Department of Education has been working to partner with schools about prevention messaging, but I think the issue that you just raised is one we also should take back to the Commissioner and make sure that she's beginning to talk about with you. We are also just starting an independent review of DCYF for any number of reasons, partly because we've had some child fatalities, which are horrible, heartbreaking, and should never happen, but partly because one of the challenges we know we have is children who are impacted by their parents' addiction. And we are seeing more and more grandparents raising their grandchildren. And this is a particular challenge for child protection workers too. So we've got a multifaceted approach going here. But I think the issue you raise is one that hasn't been identified in just that way at our level, and I think it's really important for us to do. The Executive Council did just approve yesterday a donation, and this breaks my heart that we need it, of Narcan for school districts that decide they would like it. And again, I can't, I don't like standing here saying that that's a need, but Narcan has been saving lives. And one of the things we are grappling with, and all the members of law enforcement here know it, the opioids that people are buying on the street now, they think it's heroin. Heroin is dangerous and terrible in its own right, but it's often cut with something called fentanyl, and I mentioned that early in my remarks about how we have a new law that helps us crack down on that. Fentanyl is unbelievably fast-acting and deadly. And so people think they're using heroin, they're using fentanyl. It is killing them so quickly, often before first responders can get there. But that's why Narcan is particularly important. But the other thing we know we need is to have a continuum of care after we pull somebody out of an overdose, so that they're not just being discharged from the emergency room back to the street and back to the habit. So I'm sorry for taking a long time to answer the question, but I really appreciate the focus. And again, William, if you will make sure we have contact information, we'll take it from there. Yeah.
So in follow-up to that wonderful question, something that it just absolutely perplexes me, I don't understand how this happens in our state, but we're phenomenal at alcohol sales. So, I mean, you probably know what the actual statistic is, but we do that better than most states. And we're supposed to be allocating a portion of those revenues towards solving these problems and funding these programs, and it's not happening.
Yeah.
And to me, that's the clear-cut solution. Can you help me understand what is blocking that from happening at the state level? We're not appropriating those funds when that's what they're supposed to be allocating.
We are appropriating some of the funds. We are not appropriating by the formula that it was supposed to be.
Right.
And it gets down to budgets. It gets down to looking, the budgeting process is a process in which everybody's priorities get laid out on the table, and especially in recent years, especially at the height of the recession, our revenues dropped. And so people make judgments about whether that's the best use of those dollars given all the other priorities. I don't always, budgets are also compromises, right? So I don't always agree with the judgments that are made, but we do have to get budgets settled. But that's the short answer, is that legislators and budget writers look at all of the priorities and look at how much money they've got. And I think it's clear that over the years, that money has, you don't always see the impact of prevention right away. And so I think people forget how important it is sometimes. So I thank you for raising it, because as is always the case, when people raise this and continue to raise it and raise it through the budget process and stick with it, it makes it harder for people to ignore, right? So thank you. Okay, thank you.
Sorry, I'm gonna take a second question. I want to commend you for the Medicaid expansion. I see a huge difference in the clients that we serve that now have access to health care. Unbelievable difference. Are we talking, when we're talking about adding in more, making more substance abuse treatment centers, are we talking about just substance abuse, or are we looking at some dual diagnosis clients? Because I see that as a huge hole right now.
We have, we know that behavioral health and substance abuse co-occur at a strong rate, right? I'm also always careful to say they don't always co-occur, right? And so it's important that people are focused on what the actual patient or client presents with. But we are, one of the first things I did as governor was settle the mental health lawsuits that the state was faced with, because it was clear to me that our community-based mental health capacity had been drastically reduced. We used to be so proud of our community-based mental health system, and I thought it just didn't make sense to spend all this money on litigation when we could actually use the money to solve the problem, right? And so we continue to make progress there in terms of standing up more community-based resources for mental health. We also know we need more treatment capacity, but that for substance abuse, we know that the treatment centers have to have the expertise to deal with the dual diagnoses as well. A statistic for you all to think about, we are building a new women's prison in the state, which is long, long overdue, and I'm proud of the fact that we will finally have a prison for women that is on parity with what we provide in the conditions that male offenders have. Having said that, our corrections folks reminded me yesterday that 90% of the women in our prison system present with mental illness. You know, and when you think about the human and the fiscal cost of that, it really speaks to our need to invest in both substance abuse and mental health treatment, and you continue to have my commitment. We'll do that as hard and as well as we can. Ultimately, people should be able to drive up to a medical office, and we shouldn't know what condition is causing them to go there, right? It could be mental health, or it could be addiction, or it could be heart disease, or it could be cancer, or they could just be going for their checkup. And ultimately, our system should be integrated so that we are able to look at the whole patient, the whole person, and understand all these various medical challenges for what they are, which is illnesses and chronic conditions that are treatable, as long as we're all willing to work together to make it happen. So thank you very much. Thank you all so much for the excellent questions.